Ahead of the upcoming legislative session, the American Cancer Society Action Network is advocating for improved access to health care. Cancer advocates say expanding Medicaid in South Carolina would provide health care to roughly 350,000 people in the state. Our Claire Weber spoke with a breast cancer survivor on why this need is so important.
My intention was to connect hearts with other survivors and caregivers and those impacted by cancer.
Melanie Bachman is a breast cancer survivor and now author of her new book, A Dive Through Cancer. Bachman says access to proper health care is necessary for patients like herself, as well as a sense of community.
As a survivor myself and going through treatments, I felt that it was a very isolating experience. Felt a little bit lonely, and so I wanted to target in on the emotions so that when people read it, they could connect and say, me too.
Bachman is joining the American Cancer Society Action Network's push to expand Medicaid coverage in South Carolina. It's a program designed to provide health care coverage for lower-income people.
And right now there are about 350,000 South Carolinians who do not have access to health insurance. Most often because they simply can't afford it.
Beth Johnson with the American Cancer Society says ensuring cancer patients have health insurance is critical to getting patients the help they need when they need it most.
The best way to prevent cancer is early detection. And if folks are not covered with health insurance, they have no way to go to have these preventative screenings.
For some patients living in more rural parts of the state, being able to access health care near them is a large barrier.
We have many healthcare deserts even in our state where people are having to drive many, 30, 40 minutes or longer just to find a provider if they're able to find someone.
At least 40 other states have expanded Medicaid coverage through the Affordable Care Act by lowering eligibility requirements with a goal of covering more people. It's a list healthcare advocates hope the Palmetto State will join in 2025. Claire Weber, News 4.